Okay, I'm Dr. Mary Forhan, and I'm going to be talking in depth to take a look at how health professionals and people with obesity are rethinking accommodation. So satisfaction with participation and performance of everyday activities is an important outcome for individuals living with obesity. Creating a space and opportunities are needed to achieve such outcomes. This requires that healthcare professionals talk about the facilitators and barriers to participation in everyday life with their patients. It also requires that accommodations be made. Accommodations are adjustments or modifications of actions in response to the needs and wants of individuals living with obesity. On the second slide, we will be defining participation. So participation, according to the definition used by the World Health Organization in the International Classification of Functioning and Disability, states that participation is the involvement in a life situation or the lived experience. In this case, we're talking about involvement with life situations that include mobility, self-care, domestic life, interpersonal interactions or relationships, work, community, social, and civic life. And we know from research that participation in daily life contributes to health and wellness through the acquisition of skills and competencies, and also the development of social networks of support. It's often referred to as a determinant of health, particularly within the occupational therapy frameworks. On the third slide, we're illustrating the framework of the ICF, or the International Classification of Function. This includes listing the health condition in the top box. The ICF includes 5 domains included in the framework, which include body functions and structures, activity limitations, environmental factors, personal factors, and participation. Restricted participation results when there are impairments to body functions or structures, physical factors, including gender, age, economic status, and/or environmental factors, which are factors in the built and social environment. On the next slide, we're specifically looking at obesity and some of the participation restrictions associated with the health condition of obesity. In this figure, I've inserted key threats to participation associated with obesity. Pain, fatigue, decreased range of motion, decreased muscle strength are all factors that can be related to body functions and structures associated with having the health condition obesity. Activities such as mobility, sleep quality are also impaired or limited. Factors in the built environment include restricted access to places and spaces where living actually really takes place for individuals. Factors in the social environment include weight bias and low expectations regarding persons with obesity. Personal factors that have been known to impact participation include age, gender, education, economic status, social network, and the client or patient's beliefs about obesity. These are all factors that through research we know to be associated with some individuals living with obesity that actually have a negative or some type of impact on their ability to participate in their daily life experiences. All 5 domains influence each other and have an impact on that lived experience or participation for persons living with obesity. Key areas often affected include work, self-care, leisure, and rest. There are opportunities to address all of these threats to participation within each of the 5 domains. And this is where the talk and application of accommodations to the way in which people perform activities of daily living, the use of assisted devices and interventions to reduce activity limitations, structural changes to the environment, advocacy to address social attitudes, and interventions that can address modifiable personal factors such as education about obesity as a chronic health condition. On the next slide, number 5, I'm going to be talking about working with clients that I've done throughout the last 20 years or so in the context of my role as an occupational therapist and most recently as a researcher. So I've had the privilege over the years to be hearing stories of patients living with obesity who are in treatment programs for obesity and telling detailed stories about the way in which they experience their day-to-day activities. This slide shows the results of a study in which patients in treatment for obesity were asked to describe how they went about their typical day. Three key themes emerged, which were tensions related to participation in the occupations of everyday living, in which participants described a desire to engage and participate in roles such as parenting. In this particular example, a parent described wanting to do more with their children, but finding that the mental and physical effort to do things with them was at odds with her interest. There was a gap identified between interest, ability, and opportunity. This particular participant identified fatigue, pain, and stigma from other parents as factors that created the mental and physical effort. The second theme discovered in this study was that barriers to participation. In this theme, specific structural and systemic barriers were identified. In this example, the size of seats on public transit and motor vehicles was identified as a primary barrier to engaging in participation. The third theme that was discovered in this study were strategies to participation in everyday living. Participants described a resilience and persistence to participate in things that they needed to do and or wanted to do. They described different ways of approaching tasks, such as taking longer to do tasks associated with life roles, but feeling satisfied that they were able to get things done. On the next slide is a summary of research findings from various projects from several studies over the last few years that really focused on having a better understanding of what is it like to live day to day with severe obesity. Participants described a disconnect between what they wanted to do and what they were able to do. Participants also reported participation patterns similar to adults with other chronic health conditions in the areas of daily activity and recreation. Disability status was the most significant factor in the prediction of satisfaction with participation. It was concluded that obesity does limit the diversity and quality of participation in daily living, particularly among participants living with obesity who are actively involved in treatment for obesity. And the last major key finding was that participation limitations were enhanced by barriers in the built and social environment. On the next slide, we'll talk about what constitutes a meaningful day, and that really varies from person to person. Meaningful activity is based on personal values, beliefs, and experiences. The types of activities that I've heard patients with obesity identify as important and that are restricted as a result of living with obesity include being independent in self-care activities such as bathing, getting dressed, preparing meals, participating in health services and programs, being able to do physical exercise to the degree that they want, feeling safe moving about their home and community, being competitively employed in positions that match their interests and abilities, socializing in public places with friends and family, and access to good quality health care that is delivered respectfully. These are examples of some basic life events and also some more complex participation. Specific activities that can be identified as outcomes of success in obesity management are as follows. So rather than looking at a weight-specific goal, patients were asked to identify outcomes related to performance of activities of daily living. And some examples that have been reported by patients include being able to tie my shoelaces, walk my dog around the block, reduce my fear of falling in my home, my workplace, or in my community, to be able to sit comfortably and safely in the driver's seat of my vehicle, feeling more rested when I wake up in the morning, being able to pick up an object from the floor when I drop something, feeling less out of breath walking around the store, my place of work, school, etc., being able to get up and down from the floor to play with my children or my grandchildren, feeling safe getting in and out of the shower, and another example is reducing pain in hips and knees. If you move to the next slide, it's really important to find out what is meaningful participation for patients in treatment for obesity. It can be really as simple as asking the following questions. Tell me about a typical day in your life, starting from the time you wake up until the time you go to bed. Are there activities that you need or want to do in your typical day that you find challenging? Are there strategies that you have found that help you get the activities you want and or need to get done? Another way is to really formally assess. There's several interest inventories that can be easily done in a clinical setting with very little training to go through them. There are some more formal or customized assessments often used by occupational therapists. One that's quite well known nationally and internationally is the Canadian Occupational Performance Measure, and you can find more out about that one at the copm.ca. This particular tool helps to identify and prioritize everyday issues that restrict or impact a patient's performance in activities of daily living. There is a myth that accommodating people living with obesity will make life easy and that there will be no incentive to engage in health-promoting behaviors. Quite frankly, the truth is actually quite the opposite. By creating opportunities for individuals living with obesity to participate in meaningful activities and life events, the health outcomes are quite evident in the research. We know that there's increased confidence, decreased poverty, increased energy to engage in a variety of activities, and less demand on the healthcare system. Accommodations isn't about making things fit for persons living with obesity. It's about not making people fit into things. Examples of accommodation strategies to engage individuals living with obesity in healthcare services is outlined here. We want to help engage patients with obesity in healthcare services, work, physical activity, self-care, leisure, and recreation. Energy conservation is one strategy that is often recommended to individuals living with chronic health conditions for the purposes of having enough energy available throughout the day to accomplish their daily goals. Energy conservation strategies are not energy restricting. Rather, they provide opportunities to reduce the effort or risk in performing some movements or activities, and it frees up energy for priority activities that are really important and meaningful for the individual patient. Using assistive devices such as long-handled reachers to pick things up off the floor or things that are out of reach. Using a stocking aid to help pull on socks and stockings. Using a dressing stick to help don pants, shirts, and even to hook up the hooks on the back of a bra. Pacing activities by reducing the number of steps or stages required to complete a task is really important. An example of pacing would be to organize a kitchen so that the fridge is close to the counter or table where a person can sit to complete food preparation rather than walking back and forth several times or standing at the counter. Mobility devices such as walkers with wheels and a seat or a power scooter provide opportunities for reducing the risk of falls, having a place to rest as needed, and open up opportunities to move about in the community. Mobility devices are also highly recommended in workplaces where there is a great deal of walking long distances that may burn unnecessary energy and enable a person to be able to engage more fully in the work environment. Energy conservation strategies and mobility devices also help reduce pain and fatigue. Support garments are something that is newer and coming up on the market more readily, and they are designed to help support excess skin and tissue resulting from significant weight loss. Supporting this mobile tissue is known to create a sense of stability, balance, and confidence in patients with obesity that results in greater satisfaction with participation in life events. This includes physical activity and socialization. There are compression garments available that do help with circulation and reduce the risk of developing blood clots. Those are usually require a prescription, and people are encouraged to explore whether this is a need for their patient. Examples of universal design are grab bars placed near a toilet or a seating area, seating that is flexible to support various sizes and shapes, sliding doors that maximize doorway widths to accommodate wheelchairs or scooters, wider and deeper steps on staircases to increase visual field and stability, and they create a much safer stair use opportunity. Universal design is a concept that aims to create spaces that are accessible for everyone, and more recently includes patients with obesity. It's really important to anticipate rather than react. It's important to know what the needs of patients with obesity are to create welcoming and safe spaces in the care environment. Some examples of accommodations that can be standard for all healthcare service delivery settings include providing seating that will support and provide rest for patients with obesity, having assessment equipment that will accommodate patients with obesity. This includes things like tape measures, blood pressure cuffs, and the scale. Provide assisted devices in change rooms and bathrooms used by patients. This could include long-handled reachers to help with picking things up from the floor, a long-handled shoehorn to help patients get their shoes on and off, and grab bars to help with raising and lowering from seating positions. Knowing the dimensions of doorways, weight capacity of the equipment in your office and site, and furniture, location of the elevator, and be aware of other potential barriers, including the location of parking and bus stops. All of these elements can create an atmosphere of welcome and also accessibility, and is known to increase the adherence to follow-up visits and carry on with services. It's also really important to consider eliminating all reading material that may promote fad diets or portray negative images of persons living with obesity. This does usually include most entertainment, fashion, and fitness magazines. You want your clients, while they're waiting for you, to feel welcome and safe and know that you show a great deal of respect. I've included a link to a documentary that was made in Ontario in 2013. This documentary follows the lived experience of 3 individuals living with obesity and really focuses in on identifying specific needs and benefits of accommodation. And on the following slide, there's a list of references that I have referred to some of these study results throughout the presentation, and encourage everyone to consider rethinking looking at accommodation as an avenue to health and well-being, and an opportunity to engage participation and promote the health of your patients living with obesity. Thank you.